Hey guys, welcome to chapter number 19, which is injury, poisoning and external cause codes. The code series starts with S till T series. S through T series. This chapter number 9 has been categorized. Before starting the chapter number 19, let me give a small introduction about chapter number 19. Here the code categories like all kind of injuries, adverse effect, poisoning, external cause, everything will be categorized into this chapter. First we'll talk about seventh character in this chapter. In this chapter, seventh character plays a major role because based on the seventh character itself, we need to look the documentation which seventh character is appropriate for the patient, for that scenario you need to choose. Basically, you need to focus on three things. Number one, initial. Number two, subsequent. And number three, sequela. What does initial mean? Let's take an example. Patient is coming to the hospital with traumatic fracture of, let's take, knee. Patient is admitting to the hospital with traumatic knee fracture. During this visit, we need to code the fracture with seventh character initial, stating that A initial. And the same patient is coming to the hospital after 10 days. After 10 days, due to some XYZ reasons, due to some follow-up reasons, in that case we will be assigning subsequent. Seventh character would be subsequent, which is D. And what does sequela mean? After completing the acute phase of fracture, after few months or after few years, if some complication is developed due to that acute condition, that will be considered as an sequela. The seventh character is S. And remember one thing, as I mentioned in previous chapters, or whenever we are coding encounter or aftercare codes, we need to code Z series, right? Here in fracture, no need to code Z series because you can code the seventh character as sequela or subsequent. Subsequent we'll be calling as an aftercare because the patient will be coming to the hospital very frequently for follow-up, for consultation, to check whether his or her condition was good or not, whether his or her condition was progressed or not, towards improving or not improving, whether the wound or fracture was healing, not healing, do they have any complication, yes or no. For that reason they will be visiting very frequently as a follow-up. That will be considered as an subsequent. Remember, in fracture we will not code aftercare code, which is Z series. Instead we will be coding from this seventh character which states subsequent. Clear? Next, coding injury. How to code an injury code? Let's take an example. If a patient had some hand injury, you will be coding hand injury, right? But if a patient has multiple injuries, let's take hand injury, leg injury and head injury, how you will be coding? I'll be giving two options. Number one, you will be coding three sites differently, like injury of hand, injury of head, injury of leg. This is option number one. Option number two is specified multiple codes. Let's take, we have a code stating that injury at multiple sites. What would be your option? I'll just give 5 seconds. Just think, pause the video and think. 1, 2, 3, 4 and 5. If your answer is A, that means number one, we need to code 3 codes. Watch this video. If your answer is no, we need to code only single code which states injury at multiple sites, just watch this video. In next few seconds I will be revealing the answer for that. Here we have a guideline. As I mentioned in previous chapters as well, whenever we are coding any condition, based on documentation we need to code, and how many codes we can code based on that document we need to code. That means our answer is we need to code 3 codes, because in multiple sites it cannot give or it cannot prove the patient has multiple sites like head, leg as well as hand. It just gives an information that multiple injuries, but it will not give site where the injuries was, right? That's the reason we need to code differently: head separate, leg separate as well as hand separate. And you might be having a question, if that is the case, then why that code is there in the book? If that is your question, that's a valid question. Here is the answer for that. If the physician document states multiple injury and they have not mentioned the sites, whether it might be hand, leg, head, whatever might be, they have not mentioned any site, just they have mentioned multiple injuries. At that time you will be using this code. If the physician has mentioned individual sites like head, neck, leg, hand, like that, code individually. If nothing has been mentioned, just physician document states multiple, code with multiple code. This is exactly the guideline which states in this injury part, right? Next, superficial injury. If we have a superficial injury, how we need to code? Let me give a couple of examples for that. Let's take here, I have an injury which is abrasion, so due to some fall, abrasion has been occurred. So now you need to code abrasion, right? Let's take another example. First example is abrasion, done, closed. Second example, here at elbow there is a fracture and there is a contusion as well. So here, do I need to code contusion as well as fracture? If your answer is we need to code both, here is the guideline, because contusion is part of that fracture, because contusion or abrasions are superficial, but fracture which is internal, right, which is related to bone, in this case you will be going with severity condition, which is fracture. No need to code superficial conditions like abrasions or contusions. Yes, we can code when we don't have any other deep injuries. If we have only superficial injuries, we will be coding contusions and abrasions. That contusions and abrasions are part of any deep injury, any severe injury. In that case, we will be coding that deep injury. This is how the guideline states about superficial injuries. Next, primary injury with any nerve break. Primary injury with any kind of nerve break. Let me give an example. Same example, ulnar fracture. Ulnar fracture occurred. Now in this ulnar fracture there is some nerve break as well. Ulnar fracture and nerve break as well. In previous scenario only superficial, now nerve also affected, right? In this case we'll be coding 2 codes, but the first listed code would be your main fracture followed by that nerve code, right? Because fracture is major when compared to that, because due to that fracture that injury has been occurred. Yes, to differentiate, yes, the patient has the fracture as well as the nerve break. That's the reason we will be coding 2 conditions. Carefully remember all the guidelines, because this is one of the important and biggest topic in ICD-10 CM, because all the patients who are coming to the hospital, 75% to 80% of patients will be due to some accidents, due to some incidents, injuries, due to some fractures, due to some any external cause that has been occurred at their home or at their office, at their workplace, or while they're traveling on the road, whatever might be. These are the scenarios. That's the reason. These are the scenarios which have majority of the codes. That's the reason it starts with S and ends with T. Previously, all the chapters, it will be for only one characters or one letter, right? Here we have many. We'll be learning step by step. Don't worry about that. But remember, whenever there is a superficial injury and deep injury, go with deep injury. Whenever you have deep injury as well as nerve break, code both, but deep injury should be your first listed diagnosis. Next, hydrogenic injury. Any hydrogenic injury that has been occurred, that we will be coding from chapter specific, not from this chapter specific, because something happened, injury happened due to hydrogenic. We'll be coding from that category, from respective chapters. We'll be learning in detail. We have separate session in this chapter stating that complication codes. We'll be learning over there. Just to give an information, whenever you find any documentation stating that a hydrogenic injury, you need to code from the respective chapters, not from injury chapters. So we'll be learning in detail. Clear? Next, first we have learned the 7 characters. Next, coding of injury. In coding of injury, we have learned about superficial injury, primary injury, as well as hydrogenic injury. Now we'll learn about coding traumatic fractures. How and when we need to code traumatic fractures. Remember, we have learnt about initial, right? Initial in the sense patient is coming for the first time, acute condition, acute injury or acute fracture, right? So we will correlate both the guidelines, A as well as the first guideline, which is 7th character, as well as this guideline. Will be correlate and will learn. Now, if the documentation states just fracture and the physician has not mentioned whether it is open fracture and or closed fracture, just for your information, in fracture we have 2 kinds of fracture, which is open as well as closed. If there is documentation of open fracture, we'll be coding open fracture. If there's a documentation of closed fracture, we'll be coding closed fracture. But if there is no documentation whether it is open fracture or closed fracture, in that case, how you will be coding? Here is the guideline. By default, we can consider closed fracture. Without physician documents, yes, we can consider that as a closed fracture. This is what our guideline states. Next, what does initial versus subsequent fracture mean? Already we have discussed in first guideline. Initial means the patient is coming now, subsequent is follow-up, aftercare, right? So whenever the patient is coming for initial care, we'll be coding initial as 7th character. Whenever the patient is coming for subsequent, we'll be coding for subsequent. Now, you need to remember very carefully, initial means active treatment. Currently, the patient has coming to the hospital for the first time to treat actively. That is considered as initial. After completion of active treatment, if the patient is coming as a follow-up, in that case we'll be using subsequent. There is little bit difference. You need to analyze your document whether that is an initial or subsequent, because nowhere in the documentation they will mention this is an initial visit, this is an subsequent. No, based on documentation. Let me give an example. The documentation will be like this. The patient had some motor vehicle accident. In that accident, patient had some neck fracture, and via ambulance the patient has transferred or admitted to the hospital. In this case, no need to mention that the initial fracture, right? Already we know that patient had some fracture. In that patient had some accident. In that accident, some fracture occurred. That's the reason the patient is admitting. We need to analyze and we need to consider that as an initial. What is subsequent then? The documentation will be like this. 3 months back, patient had some fracture at neck. Now the patient is coming to check whether the fracture was healing or not healing. whether the fracture is healing or not healing, whether the position was aligned appropriately or not, do we have any complication or not. They'll be taking x-ray and supervision of MD. They will be looking everything and they will be taking guidance from them. That is how it works. That's the reason whenever we have any documentation, we need to look and read the documentation appropriately in order to assign correct codes. Next, in this example, I have used a word stating that healing, right? You might be having a question. Healing means that is towards curing, right? Then do we need to code any code for that? Do you have that question? If that's your question, yes, we need to code, because that injury or that fracture has not completely cured. Still, it's a stage slowly healing. It will not heal in a day or 2 or 3. It depends on the person, it depends on the type of injury, it depends on how deep the injury was. There are n number of parameters in order to cure that injury or fracture. It may take time, but if it is healing, unless the physician document stating that healed, we will be coding all the healing condition, whether it might be fracture or injury or any other condition. And in fractures, you need to remember one thing: malunion and non-union. And just for your information, for non-union, the characters would be KMN, and the malunion, the characters would be PQR. What does it mean? It is one kind of complication or malpositioning of the bone. Let's take some fracture has been occurred at this hand that has been not aligned properly. In that case, it may lead to malunion or non-union. It depends on documentation, purely depends on physician documentation. If physician states that malunion, go with that character. If physician states non-union, go with that character. Here, purely depends on physician documentation. Few depends on our analysis, our knowledge, our skills, how we are pursuing it, how we are replicating in practical. But few scenarios need pure physician involvement, physician confirmation, physician document, because we are not an authorized person for documents. But yes, based on coding guidelines, we are the authorized persons to code appropriately based on the guidelines, official standard guidelines which we have, right? Let me give an important guideline here. Remember, we have discussed when there is no documentation of open and closed, by default we can consider as closed. Here is another guideline for that. If you see any open fracture, we will be coding open. But if you see any documentation in stating that Gusilo, GUSILO, then you need to code type of the fracture, open, right? But in open we have type 1, type 2 and type 3. In type 3 we have ABC, like that. Here you need to code type 1 or 2. Here you need to code 1 or 2, because for 1 or 2 we have single code. We'll be selecting 1 or 2 whenever you have a documentation stating that open fracture with Gusilo. Remember that type 1 or 2 you need to code. Next, whenever the patient has osteoporosis, don't code the code series from this chapter. If a patient has osteoporosis and the patient has fracture, don't code from S series or from this chapter, because that fracture might be due to osteoporosis, that might be pathological or some other, which we'll be coding from M80 series or M series, not from S series. We'll be not coding from S injury series or fracture series. We'll be coding from M series, which is osteoporosis or pathological fracture, whatever it might be. Remember, whenever you have a document like that, you need to apply this guideline and you need to follow. And already I have covered one topic initially when we started this video, like aftercare as well as subsequent, this is the major part, because whenever the patient is coming to the hospital for the second time, we'll be assigning that condition as first listed. If you assign Z condition as first listed, that would be wrong. That is a wrong coding, and that will be completely considered as an 100% error, because you have coded first listed diagnosis as incorrect. So whenever you are coding any kind of chart, if you are coding any chart from injury, remember the guidelines which you have. If you don't remember, go back and check. For every coder, every professionals, we have an feasibility, we have an option to go back and check, but that's your responsibility whether you are checking or not. My recommendation is this: whenever you feel question mark or suspicious, or you don't remember that guideline, or you don't know that guideline, go back and check. There is nothing wrong if you forget, or if you don't know, going back and learning. If something new I see today or tomorrow or whenever might be, if I see something new which I don't know, I will learn that. If it's related to my skill, definitely I will learn. If it is not related to my skill, I'll just observe. It may have some impact on our skill as well, because if you have a strong command on browsing, if you have a strong command on social media, if you have a strong command on some other thing, the same command may not have with me, because you have a different skill, I have a different skill, but you are here to learn a coding skill. You need to learn with proper steps which we have, proper guidance, proper standard guidelines, everything you need to follow in a systemic way. Then only you will safely landed at your destination. To reach your destination, there will be very ups and downs and very obstacles, right? You have to focus towards your vision. Now currently, whenever you're seeing this video, now your vision is to be expert, to be perfect, to learn this skill. That's the main key in this course of medical coding. Now, whenever we have multiple fractures, as we have discussed in multiple injuries, the same way, whenever you have multiple fractures, code multiple fractures, the number of codes you code, it gives the more information. Let's take an example. The patient had head fracture, leg fracture, ulnar fracture, femur fracture, intratrochanteric and leg fracture, ankle fracture, foot fracture, everything. Code all the conditions, unless until if you have any combination stating that ankle with foot or thigh with foot or any other complication similar to that, in that case you can go with combinations. But if you don't have any combination, don't go with multiple sites. As I gave in an example in injury, if you have a multiple site injury, we will not code unless until the physician documents that multiple sites and he is not documenting the specific site. If he is stating multiple sites as well as he is documenting the sites, don't code the multiple, code with sites. If sites were not there, then you need to code these multiple sites. This is how you will be playing with the guidelines. Once you are clear on the guidelines, you will be playing on your fingertips. Last topic in this series of injury as well as fracture, not from this chapter. In this chapter we have few more or many more, but in this video this is the last topic. I'll be continuing in the next video the rest of the topics which we have in this chapter. If you see any documentation like this, physical fracture, PHISEAL fracture, in that case we have a separate code that condition, and don't assign additionally stating that, let's take we have a physical fracture at hand or ulna, don't assign ulna fracture separately, because which is integral part. If the physician using the word physical, that site is integral part of it. Don't code additionally. because physical is something, it gives a clear picture where the anatomy site is, where the fracture occurred. It gives a better picture. Clear? In this video we have learned the 7 characters of injuries or fractures. We have learned the coding systems of injury, like superficial primary injury with related to some other conditions like ulna, deep injury as well as nerve, and hydrogenic injury, and coding these traumatic fractures, like whatever might be the fracture, initial, subsequent, healed, not healed, malunion, non-union, everything we have covered. Apart from that, we have covered regarding open, type 1, type 2, regarding M80, when we need to code, whether we need to go with osteoporosis or traumatic, aftercare Z code, we need to code in this or not, multiple fractures, and finally physical fracture. If you have any question, don't hesitate to go back and check the video. Still, if you have any question, write it down below discussion. We have a separate discussion box below in this course. You can shoot out any question over there. We'll be responding over there. See you in my next video.